Some hospitals are only specified for some of the diseases. When we talk about Maharagama is well known for cancer. So it is a specific hospital for cancer, as well as Kandy, heart bypass and kidney transplantations. So some of the hospitals are specified for some of the treatments. Primary health treatment institutions, just like MOH offices as well as dispensaries. Services implemented by the health service under the Western medical system to prevent for the prevention of diseases. Earlier, only few people get affected by heart attack, kidney diseases, as well as cancer. But when we talk about the present situation, the amount increases, gradually increases. Even a 30-year-old person dies because of heart attack. 2 years old baby dies because of cancer. There's a kidney transplantation, kidney problems and everything. So these days, nowadays in the present generation, there are so many communicable as well as non-communicable diseases are being increased. Number one, for this purpose, government conducts so many projects, so many campaigns to give awareness about the diseases. So anti-filariasis campaign, யானைக்கால் நோய் தடுப்பு முகாம்கள். In Tamil word, யானைக்கால் நோய் தடுப்பு முகாம். When you compare with India, only few amount of people got affected by filarious diseases. In advancement, government do some campaigns against anti-filarious campaign. And also anti-leprosy campaign of Sri Lanka. தொழுநோய் எதிர்ப்பு பிரச்சாரம் நாங்கள் சொல்லுவோம். It means the diseases connected with the skin. Anti-malaria campaign of Sri Lanka. I think nowadays there aren't any malarias being invented, diagnosed or something. When it start raining, only we fear of dengue. None other than we do not get any fear about the illnesses or diseases. Epidemiology unit, Family Health Bureau, not the Health Education Bureau, from 6 to 9, that's a specific subject for health and physical education. Through that subject, we learn so many things, not only about our body, but also there are several things are being covered. National Cancer Prevention and Control Campaign, National Dengue Control Unit, National Programs for the Control of Tuberculosis and Chest Diseases. When we compare the previous records to present records, only a small amount of people are being affected by tuberculosis, TB. But when we compare about the last record with the present records, the high rate is chest diseases. So many people are being got affected by chest diseases. The National STD AIDS Control Program, the Non-Communicable Diseases Control Center. For preventing non-communicable diseases, primary health facility centers have been established and are functioning. So many non-communicable diseases. To prevent all those, there are 814 centers are being functioned at the year of 2015. And also the MOH officer. Have you ever heard of the MOH officer? Do you have any idea about the MOH officer?
The
MOH.
small babies.
Yeah, MOH means who? Medical officers of health. Midwife, we simply tell as midwives also. And also PHA officers. If someone got affected by any of the diseases, the regional public health inspector, PHI sir, visits our house and control each and everything. And also, at the same time, he supervises everything. For example, if I am got affected by dengue, he visits us to find the root cause for my illness. It means dengue. And also, if there's a newborn in the family, midwife madam visit our house. I check each and everything, the mother and also the infant. Officers of the medical officers of health are established covering all the areas of the country in order to provide health services. Because of these MOH officers, we are getting better health services, isn't it? When you go to your nearest MOH office, you can see there are so many doctors, midwife madams, and also the attendants. They work their best to give us the best duty, the best outcome. Some examples of the services provided by the Office of the Medical Officer of Health in your area are given below. With MOH officers, what they do? Do you have any ideas about this? Don't look at the book. Just give me your ideas.
Teacher, can you tell the question again?
What are the services done by the medical officers of health? You should think of your regional office. It means the MOH office. MOH office means where you go to get medicine, and also the mothers who go for the maternal clinics and everything. There's a monthly clinic. Those are pregnant ladies visit for specific place, the government side. That is we call MOH office. What are the services you usually get from them? Usually MOH officers, they conduct some school health programs. Have you ever visited such programs in your school? Ever experienced such programs in your school? It may be dengue awareness program or malaria awareness program. And also in some instances, in some schools, they talk about the good touch and the bad touch. So have you ever experienced such programs in your school? The medical officer of health works to keep people healthy before they get sick. They are the ones, the MOH officers are the ones who advise us early about some of the diseases or illnesses before we get sick. For an example, dengue awareness programs. So they tell how mosquito breeds, how it spread all over. So they tell us so many things. So it is better to us to listen and to act. So we can prevent from dengue. Same like malaria. And also some other programs. And also maternal and child clinics are being conducted by the MOH. So vaccination, 2 months, 4 months, 6-old babies, 6-month-old babies vaccination, and everything is done under the MOH. Implementation of programs to prevent infectious diseases. Infectious diseases. Giving a fair knowledge about the infectious diseases. Conducting programs in the town or in the MOH office also. Implementation of programs to prevent and control non-communicable diseases. At the same time, they do so many programs about non-communicable disease, how to prevent and control ourselves, giving us knowledge about the health education programs, and also conduct maternal and child clinics, immunization programs, implementation of school health programs. These are some of the services done by MOH. Do you have any ideas apart from this? What do you think about the MOH office? Do you have any specific ideas about this particular MOH? If so, can tell. Now answer my question, okay? Everyone should answer. Have you received any vaccines at school?
Yes, ma'am.
Yeah. In which age? I think at the age of 11 or something, isn't it?
No, ma'am.
Then?
I did not get any vaccines in school, ma'am.
Okay. What about others? Any vaccines from school?
No, teacher.
Okay, but when I was schooling, I vaccinated. I think Cinnamuttu vaccine or something else. Cinnamuttu vaccination, I think. Or rubella or something. Institutions maintained by the indigenous medical system. Ayurveda is Sri Lanka's traditional medical system. Ayurvedic system. Usually so many people prefer Ayurvedic medicines because when we compare with the English medicines, the side effects are a bit low. Hope there aren't any side effects in Ayurvedic medicinal system. Treatment is often free in government hospitals. Do you know any Ayurvedic hospitals or any free dispensaries?
Yes, ma'am.
Do you know? Then tell me. Name of a Ayurvedic hospital?
Ravana Ayurveda.
Okay, any other? Have you ever visited such places? In Matale, I think 10. There's an Ayurvedic hospital. Totally free of charge. Has anyone used any Ayurvedic medicines at home?
Yes, teacher.
Ah, that's fine. Why do you choose Ayurvedic medicinal system? Why did you choose Ayurvedic medicinal system? There may be specific ideas to choose. Do you have any specific ideas regarding that? When we compare with the cost with the English medicine or Western medicine, the cost is low and also it's completely free of charge, provided by the government. And also there aren't any side effects. That's why most of the people choose Ayurvedic medicinal system. Actions to be taken by the public in order to prevent these diseases. Okay. The health service of Sri Lanka achieved a great improvement. However, non-communicable diseases such as heart disease, diabetes, kidney diseases, and cancers are increasing rapidly at present. Many people fall sick due to smoking and drug addiction. The main cause for each and every disease is smoking as well as the drug addiction. Heart attack, smoke. Cancer, smoke. Diabetes, drug addiction. This is simplified answers for each and every illnesses or diseases. The main thing is smoking. You may be not a smoker, but if you are sitting by the side of a smoker, you will get affected than the person who is smoking. Brings us the biggest loss in our lives. First one they have given following medical advices. Following medical advices means taking medicines properly. Usually when you take a medicine, doctors tell us you have to take this twice a day or thrice a day, half or whatever it is. They give us a particular simplified prescription. So we should take them in a proper way. So that is following medical advices. Following good health habits. Washing our hands before eating, washing our hands after eating, as well as when we go for traveling and everything. After that, when we reach home, it is our biggest responsibility to wash our hands. Not touching your noses, nostrils, and each and every time. So brushing your teeth properly. So this is some of the good health habits. Consumption of healthy foods and drinks. When eating fresh vegetables as well as fresh fruits, homemade drinks items and everything. Avoid as much as fast food and also soft drinks. Engaging in exercises adequately. Walking, or doing any sports which help us to keep us fit. Refrain from smoking and intoxicants. Keep our heart and lungs healthily. So if you stop smoking and consuming alcohol, your heart and lungs will be in best condition. That's the main thing talking about the health services. Start writing the notes. There are, I think, 5 pages are there. Small points are there. Start writing.
Teacher, can you put the other notes in the chat?
Okay, I'll put.
Finished, ma'am.
Finished, teacher.
Add the balance note to the checkbox. Finish writing those all. Everything done. Everyone done.
Yes, ma'am.
Akil, Abdul Qadir, Abzal Aslam, Anshada, Julia B. Minham, Anna, Jishnudan, Shuraim, Tanaviya. Everyone done.
No, teacher.
Yes, ma'am.
Yes, teacher, all are done.
Wait. I think
No, ma'am.
okay. Done. Do.
ma'am.
Look at this activity. Name the staff of the hospitals and the Office of Medical Officer of Health according to their designation. Staff of the hospital as well as the staffs on the MOH office according to their designation. Answer these two questions. List separately the services rendered by the hospital. Answer the first question itself.
Teacher, finish.
Finished, ma'am.
Read the answer. In the staff of the hospital, in the office of the medical officers, officer of health, according to their designation. Ma, read out your answer. Others listen. Those who done can read out the answers. Hurry up. Name of the staffs of the hospital. Who are the staffs of the hospital according to their designation?
Nurse.
Yeah, nurse, correct. Nursing student.
Doctors.
Yeah.
Midwives.
Labor, midwife.
Mm. Yes, and also nursing students, doctors, doctor trainee, pharmacist, ward attendant. Mm. Tell me. Read out your answer. What you have written. Pharmacist, laboratory technician, radiographer, cleaner, security officer, ambulance driver. என்னம்மா? Dental surgeon. Doctors means consultant and also the specialist doctors. Intern doctor.
VP doctor.
VP. It means
She's eye
Hospital
doctor. She's eye doctor.
any other answers? Healthcare assistant or attendant. Ward clerk. Security officers. Radiographer. Physiotherapist. Dentist. So you can add those people also. List separately the services rendered by the hospitals and the office of the medical officer of health preventing infectious and non-communicable diseases in your area. You have to write 3 points separately for each and every person. It means hospitals for 3 and also MOH 3. What are the steps taken to prevent infectious and non-communicable diseases? What are the services done by hospital? And what are the services done by MOH? 3 services are enough.
Bring me a bring. Free vaccination at school.
Tell me, Ma. Tell me. Read out your answer.
Free vaccination at school.
Infectious and non-communicable diseases, okay? For infectious disease and also for the non-communicable diseases. What are the measures done
Teacher,
by MOH? That is the question they have asked. Tell me.
teacher, heart attack, diabetes, and blood pressure.
Yeah. Diabetes and blood pressure, those comes under non-communicable diseases. What you want to write? தமிழ்ல சொல்லுங்களேன் உங்களோட ஐடியாவை என்னாண்டு.
Excuse me, teacher.
Yes, me.
Teacher, இந்த கேள்வி சரியா கிளியரா விளங்கல teacher.
இப்போ எங்களோட ஊர்கள்ல வந்து நிறைய இன்ஃபெக்ஷஸ் டிசீஸ் அதே மாதிரி நான் கம்யூனிகேபிள் டிசீசஸ் தானே. ஹார்ட் அட்டாக், கேன்சர், கிட்னி பிரச்சனைகள், அதே மாதிரி டயபிட்டிஸ், அப்படி நிறைய நோய்கள் தானே. அந்த நோய்கள் வாரதை தடுக்கிறத எங்களோட ஹாஸ்பிட்டல்ஸும் இந்த எம்ஓஹெச் ஆஃபீஸும் என்னென்ன செய்கிறாங்க, அந்த நோய்கள் வாரத அந்த வராம தடுக்கிறதுக்கு என்னென்ன முயற்சிகள் செய்யறாங்க அப்படின்ட்டு இந்த கேள்வி கேட்டிக்கி. உனக்கு விளங்கிச்சா இப்ப?
Okay, teacher. Yes, teacher.
ஓகே. Those who answered can read out the answer for the second question. Finished writing, Dulia Bay? Finished or still writing? Shall we discuss the answers?
Teacher,
Yeah, ma.
on MOH office,
Hmm.
awareness program,
Yeah, correct.
immunization,
Yeah,
implementation of programs to prevent infectious diseases,
yeah, infectious diseases. Hmm.
implementation of programs to prevent and control non-communicable diseases.
Yes. Okay. And what comes for
On hos-
hospital?
On hospitals, provide treatments to cure diseases.
Laboratory services.
Okay, correct. Is that all, Shuraim?
Yes, teacher.
Health education.
Yeah, health education. Very good, Shuraim. In Akil, only one answer. Very good, Shuraim. You have tried your best. Whether it is right or wrong, that's next part.
Thank you,
But you
teacher.
tried. That's how you have to be. What happened to others? Abdul Qadir, what happened to you?
Teacher.
Minham, Jishnudin, Tanavia, Akil, what about the answer? Read out your answer. Waiting for your answers.
Teacher.
Read out your answer for the question, ma.
Teacher, shall I tell the answer for the second question?
Yeah, you can.
List separately the services rendered by the hospital and the office of the medical officer of health preventing infectious and non-communicable diseases in your area. For example,
Okay.
free vaccination,
Yeah, correct.
vaccination of
Vaccination for pregnant
vaccination
mother,
of
infants.
uh,
For
diseases,
infectious diseases also, yeah.
vaccination of diseases that go through the other people.
Yeah.
That's all, teacher.
Okay, mashallah, ma, very good. What about others? What about others? Jishnu then, Aslam, Anshada. Read out your answers. I have given some answers on the chat box. Can see. Copy those answers. Services to prevent infectious diseases. Hospitals, diagnosis and treatment of infectious diseases. Dengue, TB, COVID-19 and influenza. Isolation and ward care for infectious patients. Laboratory testing. Emerging medicines and antibiotics. Emergency care for severe infections. Reporting notifiable to MOH. These are the services done by the hospital. In some
Outbreak management.
Excuse me, teacher, should we write this as note?
Yeah. Hurry up, start writing these answers. Answer for the second question. Conducting school health programs, quarantine and disease surveillance and notification, health education on hygiene and sanitation. These are the services done by MOH.
Finished, ma'am.
Okay, what about others? Okay, shall we discuss about the education, the next topic?
Okay, teacher.
Okay, education. Why do you go to school? Why do you go to school?
To study, teacher.
To make our future
Studies,
bright.
Yeah. To learn good and bad things, to learn discipline,
To make our future better.
to make our future better. And also school is the place which mold us to be a good citizen of the country. Is it possible to live without education? Is it possible?
No, ma'am.
No, it isn't. Education is a must. So without education, we are zero. Just like discipline. Education is the most valuable resource of the human resources. Sorry, sir. The most valuable resource of a country is the human resource. Most valuable resource in a country is human resource. Education is important as the main factor influences the advancement and well-being of a human resource. Education is compulsory for the child to 5 to 18 years of ages. Education is compulsory. It is our rights also. Education is a human right. The right to education is recognized as a human right as well as right of the child. according to the world, according to each and every country, suggests that education is the right of a child. So as a human being, it is our biggest right to get the knowledge and the education. In so many countries, education is also a public service, just same like Sri Lanka. When you talk about educational field, government allocate a large amount of money on behalf of students. It means for the educational purpose to the school. When you talk about the government schools, you are given free uniforms, free books also. Nowadays, they are 1 to 5 grade students are being given midday meal also. So all these are for free of charge. Education is also free from government schools. There are so many benefits. We can talk about the education as public service. Providing education free of charge from primary education to higher education. From grade 1 to universities, everything is free. After your A-levels, if you apply university, at the same time, you are eligible to apply some of the scholarship, Mahapal, all those funds. So from there also, you get some of the benefits from government. Education has been made compulsory for children up to 18 years of age, up to all levels. It is compulsory. Grade 1 to all levels. If you get the best knowledge, if you're well educated, you may get a good job also. Allocating a large sum of money for education for the annual budget. That's why it's so earlier. Government allocate a large amount of money for the schools, for the education fields. Free distribution of textbooks and uniforms. Free of charge uniforms and the textbooks. Providing a wholesome meal for school children identified as needy with nutrition. From last year, they are giving midday meals from grade 1 to grade 5 students. Taken steps to develop nearly 7,000 schools to enhance the concept that the nearest school is the best. From last year also, it is being handled. Nearest school is the best because some people, usually everyone, prefer the best school. After the scholarship examination, those who qualified means pass the scholarship examination, search for a better school. So the concept says that the nearest school is the best. The school which is in your region is the best. Government is trying to implement this concept around the country. Hope only 30 or 40% being success. Private schools, higher education institutes and vocational training institute are run by the private sector too. There are so many private schools nowadays. When you talk about the Matale district, there are so many. And also higher educational institutes and also vocational training. NVQ qualified certificates are being issued through vocational training institutions. There are some government side institutions also there, same like the private sectors too. Early child development centers are conducted for preschool children by the local bodies, voluntary organizations, religious institutions, and the private sector. They're talking about the preschools. There are some governmentized preschools as well as privatized, and also in some areas, in some regions, religious institutions, they conduct preschools for free of charge. In some instances, you have to pay some amount of money. Some are completely free. Draw your attention to the description given by following persons regarding the educational employment. I am a music teacher. From my childhood, I love to sing songs and recite poems. However, it is my teacher who improved my skills. Some change their aims or goals or the ambitions according to their ages. When we were small, our ambition was to be a doctor. When we come to grade 8 or 9 classes, ambitions differ from that. So after the A levels, when we sit for the A levels, everything completely changes, even the ambition also. You may have so many skills and talents. The teacher will definitely identify your talents and skills. So from there, you can develop. You can go on that way also. If you are well talented in sports, you can reach the highest position in the sports fields. And also, if you are well talented in arguments and everything, debating fields, you can be a lawyer one day. So it is up to you. Your teacher is standing behind you. Teacher will definitely help you to identify your talents and skills. Teacher will help you to develop that also. I entered the university after passing my A-levels from the village school. I was able to obtain a degree in music. Free education helped me to achieve this status. I teach children very happily and enthusiastically. So many students from village side, region sides, so many students are being benefited by the free education. Those who are rich can pay a large amount of money for school as well as for the books and also for the uniforms. But the poor or the needy people or middle class people, they think thrice to spend such amount of money on behalf of education. So that's the main reason for most people choose government schools, government education system. Everyone can afford that amount. I think for the whole year we have to pay 3,000 or something else. Uniforms, textbooks, everything was given free of charge. I'm a chief inspector of police. I joined the police as a sub-inspector of police after passing my ALs from the village school. I was a clever sportsman at school. I succeeded in several provincial sports competitions. My school, my teachers, and free education helped me to improve those skills. I consider it as my bounden duty to serve my motherland devotedly. So this person is also talking about the free education. If you want to get succeeded, you have to work hard. Some people they neglect for the things how they get for free. Some people they usually neglect the free items. But remember, it worth a lot. So many people they benefited by this free education system. I served as a doctor in the hospital in our village. From my childhood, I had been my dream to become a doctor. I received my primary education from my village school. I entered the central school after passing the grade 5 scholarship examination. I entered the medical faculty after passing A-levels well. I received bursary also. Free education fulfilled my expectations. My determination is to serve my motherland to repay for this. I respect my teachers with great regard. When you go through this free education field, you get so many benefits from grade 5, OLs, A levels, and also in university fields also. There are so many offers are being given by the government for the students. Government issue free of charge for the education fields. Shall we write the notes on the next class? 6, 9, 15 now.
Okay, teacher.
Okay, Ma, thank you so much for joining.